Hey folks, Howard Lux. Today's question that I received through my website is a very common one. It deals with partial rotator cuff tears. What are they? And this question in particular wants to know whether or not they can heal. So the rotator cuff, as we all know, are a series of muscles around the shoulder. They're underneath your large deltoid muscle, so you can't touch it or feel it. But the rotator cuff coordinates the motion of the larger muscles. So if you are missing your rotator cuff, the shoulder's not going to work very well. But you have to be missing a very large portion of the rotator cuff for the shoulder to become dysfunctional or not function properly. Now, as we age, oftentimes our rotator cuff starts to wear out. That's a process that we call tendinosis. Now, it's normal, and it just means that if we MRI a shoulder of a 40, 50, or 60-year-old, the rotator cuff's going to look different than it does in an 18 or 20-year-old. For most of you, it doesn't hurt, it's not bothering you, it's nothing to worry about or stress about. Now, sometimes the tendinosis, or this change that happens to occur in the rotator cuff, can be interpreted by a radiologist as what's called a partial tear. That does not mean that your rotator cuff is torn. It literally means that a small portion of the rotator cuff has separated from its bony attachment. Now, it may be actually detached, or it may just be that the tendinosis and degeneration makes it look detached. Now, the research in this is pretty clear. Many of these tears actually heal themselves when they go back and MRI these shoulders a few years later. Very, very few partial rotator cuff tears end up requiring surgery. The vast majority of people are going to get better with physical therapy. Now, let's take an 18 or 20-year-old, a thrower, or an overhead athlete. Partial thickness rotator cuff tears are very common in overhead athletes as well. That is probably due to overload. So they're doing too much with their shoulder isn't ready to deal with all the stress, and they actually do suffer an injury. Do those need to be repaired? Well, that's a good question. Sometimes the answer to that is yes. However, we usually only answer that yes when they have failed a pitching program, if it's a baseball pitcher, or a very aggressive physical therapy program. So even the majority of 20-somethings or teenagers are going to recover quite well from their partial tear and not require surgery on it. Who does need surgery? Well, so if you have severe shoulder pain and everything else is normal, and you've tried physical therapy, perhaps you've tried injections and over-the-counter medications, and your symptoms and pain do not improve, and you especially have severe pain at night and pain when trying to work, then perhaps surgery might be of benefit to you. That's where we sometimes employ this bioinductive patch to try and get these rotator cuffs to regenerate. It's not always successful, and there's always risks in surgery, so surgery should be your last option. So, to answer the question, do some partial thickness rotator cuff tears heal? The answer is clearly yes. Do all of them heal? No. Do all of them require surgery? No. Do some of them require surgery? Yes. But that depends on your examination and your quality of life. Take care.